What is this trend on Instagram where doctors are showing patients exactly where to inject Botox? When did we decide that turning medical procedures into public tutorials was a good idea? You do not need to teach your clients how to inject. That is not education, that is confusion. Patients are not trained injectors. They do not understand anatomy, depth, muscle dynamics, dosing, or complication management. Yet we are handing them simplified maps and expecting them to interpret it correctly. You can educate without compromising your authority. You can speak about results. You can explain possible side effects. You can guide patients on what to expect and what to do and what to avoid in the 48 hours after treatment. That is responsible communication. But showing injection points as if it is a universal template ignores one critical fact. Every face is different, and then we create a bigger problem. One doctor shows one pattern, another shows a completely different approach. Each one learned from a different course, a different mentor, a different philosophy. Now the patient is not informed, they are conflicted. They come into the clinic and say, do not inject there, inject here, I saw it online. At that point, you are no longer leading the treatment. You are negotiating with misinformation. This is what happens when doctors prioritize content over clinical authority. We are not influencers first, we are medical professionals first. If your content creates doubt instead of trust, it is not education, it is noise. And maybe the real question is this: do we now need to start teaching doctors how to do social media properly before they start teaching patients how to inject?